Welcome everyone to our press conference focused on America's maternal health crisis and how federal investments through the Build Back Better Act can help improve care for all women and birthing people. I'm Dr. Jamila Taylor, Director of Healthcare Reform and Senior Fellow at the Century Foundation, and one of the hosts for today's call. I will start by thanking our co-hosts, the Center for American Progress, the Center for Reproductive Rights, Black Mamas Matter Alliance, and In Our Own Voice. This call is on the record, and press will have an opportunity to ask questions following brief remarks from our speakers. A recording of this call will also be made available afterwards. Before I turn it over to Chairman Pallone, I want to set the stage for where we are. This month, the House Energy and Commerce Committee included $1 billion in historic investments toward maternal health as part of the Build Back Better Act text. This includes every reconciliation eligible aspect of the Black maternal health Momnibus. Investment in mandatory, permanent extension of postpartum Medicaid coverage to 1 year, as reflected in the Mamas Act, is also included. These advancements are essential and long overdue. Black women today are 3 times more likely to die of pregnancy-related causes when compared to white women. Racial disparities in maternal health, which stem from historic and systemic racism, must be addressed. That's why it's absolutely critical that maternal health provisions are included in the final reconciliation package and signed into law. The weeks and months ahead are where the rubber will hit the road. You'll hear from maternal health champions in both the House and Senate on how to get us over the finish line. To kick us off, I'd like to introduce Congressman Pallone, Chair of the House Energy and Commerce Committee. Chairman Pallone, over to you. Maybe we are still waiting for Chairman Pallone to join us. So in that case, let's have Senator Cory Booker kick us off.
I'm really appreciate that and just grateful to be on with these incredible leaders, and especially my sisters in service in the House of Representatives. I'm just inspired by their continued effort, as well as my New Jersey Chairman Pallone. And so we're in a public health crisis. It's as simple as that in the United States of America, one that's really shameful. And I'm not just talking about, obviously, COVID-19 and all the challenges there. I'm talking about the shameful distinction, of having the highest maternal mortality rates amongst wealthy countries. It's because we have a healthcare system that really is saddled with numerous problems, but very particularly including bias and racism that's disproportionately killing Black and Indigenous people. As part of this challenge we have is that the problem's getting worse. The maternal mortality rate has risen in the United States over the past 3 decades. And the intersection of COVID, this pandemic, has only further complicated and exasperated this already very shameful, wretched issue. So now more than ever, we need to take action and confront this crisis. And that's why I'm so proud of the work we're doing across the Capitol on this effort. And so the solutions are there. They're common sense solutions, and they must be included in this reconciliation package. Some of these policies include expanding Medicaid coverage to 1 year for postpartum pregnant people in every single state as outlined in the Mommies Act and Representative Kelly's Mamas Act. And it's got to involve investing in community-based organizations, increasing access to doula support, working to eliminate racism and bias in the medical profession, and a lot of other concrete policies that are outlined in the Black Maternal Health Momnibus Act that Representatives Underwood, Adams, and I introduced earlier this year. And so again, I want to thank all of our partners, especially the New Jersey delegation as well, with Chairman Pallone, for including these essential priorities in the Energy and Commerce Committee's Build Back Better legislation. It is critically important that these policies pass the full House and remain in the Build Back Better Act as the legislation moves to and through the United States Senate. I'm going to be doing everything I can to make these policies pass. and signed into the law by President Biden. I was in the Oval Office with him yesterday, specifically talking about the Black maternal health crisis as it's something he's committed to meeting. And so one final point, though, I'd like to raise is that the CDC estimates that 3 in 5 pregnancy-related deaths are preventable, 60% of them. So it is not a matter of can we save lives. Clearly, the data and the scientists know that it's simply an issue of, do we have the will to confront these deadly disparities in maternal health outcomes? And these policies we are discussing today and will be continue to be discussed will save lives. Thank you.
Thank you so much, Senator Booker. Now let's pass things over to Chairman Pallone.
Hi, Dr. Taylor, thank you. And let me thank you for all the incredible work you've done to support the crafting of the Build Back Better Act, which really takes what I consider long overdue action to address the maternal health crisis in the country. And let me thank my senator from New Jersey and friend who's been out front on this issue in the Senate also for a very long time, and appreciate the remarks that he made about what we're trying to accomplish. But all of us know, and I don't want to repeat the statistics, Dr. Taylor, but we know that we have the highest rate of maternal mortality amongst the world's economically advanced countries. We know that the maternal mortality rates, in particular for Black women in the US, are more than 3 times higher compared to the rate for white women. That's unacceptable. We know that the infant mortality rate for babies born to Black mothers is more than twice as high as the rate for those born to white mothers. I mean, in a country as wealthy as ours, that's just not, it's just inexcusable. And so that's, I consider this disparity a national crisis. And that's why in the Energy and Commerce Committee, we've tried to deal with this in a transformative way. So we do believe that the bill that we reported out last week includes some significant provisions to guarantee that new moms, for example, have Medicaid coverage for a full year postpartum. That's probably the most significant, because what happens is if someone, as income rises, that in some states they're just thrown off Medicaid during that postpartum year, and that's not right. So what we say is you can't do that. We're not going to go back and test your income and throw you off during that first postpartum year. And then the other thing that we do, I want to list a bunch of things really. These are there's about $1 billion, Dr. Taylor, in the bill that came out of the Energy and Commerce Committee, that with the provisions that come from the Black Maternal Health Momnibus. And there are 4 of those basically. One is investments in public health initiatives to address social determinants of maternal health. Second, to fund programs to train, grow, and diversify the perinatal workforce and the maternal mental health workforce. Third, to support research at minority-serving institutions to address adverse maternal health outcomes. And fourth, to advance maternal health equity through training on racism, bias, and respectful maternity care. So those are the most important things that come out of the Black Maternal Health Momnibus that I wanted to mention. Now you couple that with so many other things that we're doing, for example, expanding that Medicaid population in the red states that haven't done so, right, by having a federal Medicaid program, and also making the ACA subsidies or tax credits permanent. And I won't go on, but I just wanted to take a moment to recognize 2 of our outstanding leaders on the Energy and Commerce Committee that have been so much involved with this, and that's Congresswoman Robin Kelly and Lisa Blunt Rochester, who've really taken the lead on our committee. And then outside of our committee, Lauren Underwood and Gwen Moore, who've been champions for moms and maternal health for years and put together a lot of this, a lot of the things I already mentioned. But I mean, the last thing I will say is that our work is not done. You know that there's going to be an effort. I call it the haircut. I don't know if maybe that's too flippant a word, but there's an effort before this goes to the floor to trim down this $3.5 billion reconciliation or Build Back Better Act And there's also the same thing in the Senate. And so it's really important that everyone involved insists that these provisions that affect maternal health do not become part of that trimming down. It's not a lot of money that we're talking about here, but these are very valuable programs where this money will really make a difference. So I would just plead with all you to continue, Dr. Taylor, the work and you that others have done to make sure that these things don't get taken out when we have final passage of the bill. And again, that's where Senator Booker comes into play, particularly in the Senate. So I want to thank him again. Thank you, Doctor.
Thank you, Chairman Pallone. And now we'll pass things over to Representative Gwen Moore. Representative Moore, you're still on mute.
Well, they finally figured out how to mute me, I see. Listen, I'm so excited to be here with you virtually. And for me, maternal health is personal. I am a mother, a grandmother, and a great-grandmother. And what I'd like to say about that is that I preside over a queendom. And so I'm all about the mothers. That's why I've made protecting the health of mothers of color a priority in my stewardship, not only here in Congress, but when I served in the state legislature as well. I'm thrilled that the legislation that I championed, the Perinatal Workforce Act, which is part of the Momnibus spearheaded by Representative Alma Adams and Representative Underwood and co-sponsored in the Senate by Senator Booker, is included in this reconciliation package. And has been spearheaded and shepherded through with the Energy and Commerce Committee and in the MARC. I am trying to click on just this. There you go. Excuse me, technical difficulties. Listen, this bill would boost the resources to help train a more diverse maternal health workforce. The MARC included $275 million to grow and diversify the perinatal health workforce, including nurses, midwives, physicians assistants, doulas, and maternal, mental, and behavioral health professionals, including $50 million, especially for doulas. And I'll tell you, as a person who had a baby at age 18, didn't know what I was doing, person who has given birth to 2 of my 3 children at home, I can tell you that expanding the perinatal workforce is important toward reducing maternal deaths, mortality, and morbidity. My bill and the others in this Momnibus take a giant leap forward in our fight to end maternal mortality in our country, which shamefully, there's no reason that the wealthiest country in the world has one of the, is one of the places where women are more likely to die than women in other so-called civilized first world countries. And as you know, pathetically, Black and Native mothers are 3 times more likely to die from childbirth complications. And COVID-19 has made the birthing process even more stressful for pregnant people. This is a preventable crisis, and we've already heard that before, and we have the resources to address it. And this, of course, is something that ought to be of concern and interest to people, no matter where they are on the spectrum of abortion and pro-life and choice. Really saving the lives of mothers ought to be a legislative focus. I focused my legislative efforts also on trying to create a culturally competent workforce. And so one of the problems Black women face now is not being taken seriously in the doctor's office. I've experienced it myself. That's why I only had one baby in the hospital. It was very traumatic for me to be in a situation where I felt unsafe because I was a young Black, a woman by myself. A culturally competent perinatal workforce will secure women's access to supportive professionals who understands a mother's culture and family dynamics and provide guidance to mothers during the birthing process. And in the committee I serve on, the Committee on Ways and Means, I help secure a provision in our Build Back Better bill to provide new funding to help train low-income women, primarily of color, to become midwives and doulas. And I'm thrilled at the Build Back Better legislation that includes an expansion of Medicaid coverage overall to try and cover more people, especially in states like Wisconsin, that have, unfortunately, one of 12 that have refused to take up the ACA Medicaid expansion. And this will be a game changer, given that Medicaid covers 40% of US births. The need for care doesn't end when a person gives birth. Expanding Medicaid coverage will improve the health of millions of mothers and their babies. The bill will also provide new mandatory requirements that Medicaid cover postpartum women for 12 months and provide the full Medicaid package. And we know that it's time that we need to pay close attention to those who have given birth. Currently, Medicaid covers for 60 days. And while the American Rescue Plan created a new, easier option for states to choose, when it comes to maternal health, we need to make it a mandate. We need for these provisions to stay in the reconciliation package. And this should not be up for debate. We have a once in a generation chance to save mothers of color, make more health care more accessible, and ensure our perinatal workforce is meeting the needs of mothers. We can't worry about the cost of the legislation because the cost of inaction is too high. You can't put a price on a mother's life. And America is facing a maternal health crisis, and in emergencies, we respond. We must be more proactive and protect the lives of mothers of color and put mamas first. And I will do everything in my power to make sure President Biden signs the Build Back Better Act with these provisions, and I yield back.
I guess I'll just jump in from the great Congresswoman Gwen Moore. First of all, thank you so much to Century Foundation, Black Mamas Matter Alliance, the Center for American Progress, the Center for Reproductive Rights, and the National Black Women's Reproductive Justice Agenda for organizing this. I'm so grateful to all of you for the work you do to eliminate the Black maternal health crisis that we are facing in this nation. Grateful to my chairman. We hosted a marathon and felt like 50-hour markup to Build Back Better. And it was exhausting, but it was so worth it because at the end of the marathon markup, there were some great things that we were advancing. I won't go through everything because the chairman has mentioned it and Congressman Moore has mentioned, but I am, as a chair of the Congressional Black Caucus Health Brain Trust and founder of the Caucus on Black Women and Girls, I know just how badly health equity investments are needed to improve access to care for Black Americans. And I'm thrilled that, and you've heard it already, that our draft of the Build Back Better Act includes the provisions from my Mama's Act that will extend postpartum Medicaid coverage for 12 months after delivery. I've been fighting for this key maternal health investment since the 115th Congress. So I'm just thrilled, and I'm thrilled that it was in the American Rescue Plan, but now so delighted and excited that we're trying to make it permanent and not, so it won't sunset in 5 years, and that the Medicaid coverage gap will make it for everyone across the United States, because it shouldn't depend on, you know, your zip code. Your healthcare should not depend on that. So I'm really thrilled about that. And also, like Congressman Moore said, it's personal. I'm a mom and a grandma, and my husband and I have 4 kids between us. 2 of the girls have had kids, but the oldest daughter has not had a child. And I have a 3-month-old grandson, and I was worried. I just know too much information now, I guess. And I was really worried 3 months ago when she was delivering her baby and we didn't hear anything and it was taking longer. But thank God I have a healthy baby boy. And just my work with Charles Johnson around his wife, what happened, that's what really sparked me getting involved, because I had no idea that this was such a problem 6 years ago. But when I heard, I jumped right into action, because again, we need health equity. It's embarrassing that the richest country in the history of the world has this maternal health problem, and specifically with Black and Native women. There's no excuse for it. So hopefully we will get this passed. I am an optimist. I'm going to say we're going to get this passed, and with all of us working together, we will. And thank all of the groups again, because you definitely are the wind beneath our wings. So thank you so much. And I turn it over to my wonderful, intelligent, I can't say enough about her, Lisa Blunt Rochester.
Thank you so much to my good friend, Robin Kelly. First of all, thank you for your leadership. You know, Robin was probably ahead of the curve, you know, really pushing the focus on maternal mortality, in addition to so many other important issues. And as vice chair of Energy and Commerce, she has done a great job in advocating, along with our incredible chairman, Frank Pallone. Frank, we see you there. We're going to get you a ring light, but we see you over there. We want to thank you so much for all of your leadership in ensuring that this did not fall off the plate, that this continued to be a priority. So first of all, thank you to the leadership on Energy and Commerce. And let me begin by thanking the Century Foundation and all the incredible partners for hosting today's press conference, and to my colleagues and allies who are speaking here today. I think one of the individuals who was a part of Alma Adams and Lauren Underwood's coalition is our Vice President, Kamala Harris. And so the great thing, I wanted to make note of that, because not only here in Congress, but also in the White House, we have a champion who understands these issues and is pushing for them as well. And it's been said so many times already that we have a maternal mortality crisis in the United States. Our rates, as others have said, are just over the top compared to countries that are similarly situated. And we know that this problem is particularly acute for Black moms, who are dying at 3 to 4 times the rate of our white counterparts. We also know that those experiences don't change based on your education level or your wealth or your social status. We on our committee have heard these challenges during testimony at committee hearings. We've heard stories from women like Angela Spicer with her national bus tour highlighting maternal mortality and mental health, to superstars like Beyonce and Serena Williams, to our own personal family members, including my sisters who have had challenges as well. The disparities are real. Systemic and institutional racism is real. And the challenges are real, but so too are our opportunities. That's why I was proud to introduce the bipartisan Moms Matter Act as part of the comprehensive 12-title legislative effort to reduce maternal mortality called the Momnibus. I love that, the Momnibus, because first of all, it is about us. Oh, Frank got a ring light too. It's about, look, and then there was light. And that's the hope of all of this work. I was able to introduce a bill with my Republican colleague, John Katko of New York, along with Senator Kirsten Gillibrand. And the Mom Matters Act is focused specifically on mental and behavioral health care for moms and birthing people. Research has shown us mental health conditions are one of the leading causes of pregnancy-related deaths. That's why the Moms Matter Act makes real investments in community-based mental and behavioral health programs. It ensures that those programs are culturally competent, which we also do by investing in expanding and diversifying the maternal mental health workforce. And as I said, my bill is one of the 12 in our comprehensive package. The Momnibus deals with issues from the social determinants of health, the perinatal workforce, support for incarcerated mothers, pregnant and postpartum veterans, and so much more. I'm so proud to help lead this comprehensive package that would help address one of the more urgent public health crises in our country. And I am also proud to do it in the company of such phenomenal leaders, sheroes and heroes, including Lauren Underwood, who is a champion and has really helped to push this issue to the fore. Ladies and gentlemen, those of you who are from the press, please welcome Congresswoman Lauren Underwood.
Well, thank you, Representative Blunt Rochester, and thank you to the Century Foundation, Black Mamas Matter Alliance, the Center for American Progress, the Center for Reproductive Rights, and In Our Own Voice for hosting this press call and for your steadfast leadership year after year to achieve true birth equity here in the United States. I am also just so pumped to be joined by our colleagues, the chairman of the House Energy and Commerce Committee, Frank Pallone. Thank you for being here. Senator Booker, Representative Moore, Representative Kelly, Representative Blunt Rochester. I mean, honestly, thank you for all that you do to further our mission to save moms' lives. Last Wednesday was so historic for the Black Maternal Health Caucus that I co-chair, for House Democrats and for the Biden-Harris administration, and most importantly for families across our country. And that's because the most significant step that has ever been taken in the Congress to end our nation's maternal mortality crisis, right? We took that significant step thanks to the tireless efforts and leadership of Chairman Pallone, and the Build Back Better Act legislation advanced by the Energy and Commerce Committee included comprehensive investments from my Black Maternal Health Momnibus Act and a mandatory provision that will make federal funds permanently available for states to spend on expanded postpartum Medicaid and CHIP coverage to 1 year in every state. These investments build on important progress that we've made on maternal health this year. In March, President Biden signed the American Rescue Plan into law, which included a temporary provision to create an optional pathway for states to extend postpartum coverage to 1 year. In May, the House passed my Protecting Moms Who Serve Act with unanimous bipartisan support, ensuring that veterans have access to high-quality maternal health care and robust support. In June, additional Momnibus bills advanced in the Energy and Commerce Committee, and in July, the Maternal Vaccination Act advanced out of the committee with unanimous bipartisan support. Now, these were exciting and important steps, but we know that our nation's maternal health crisis is multifaceted and requires a comprehensive policy response. And that's what the Momnibus is, a sweeping set of 12 bills that build on postpartum Medicaid coverage expansion to address every driver of maternal mortality, morbidity, and disparities. The Momnibus provisions in the Build Back Better Act legislation advanced by Chairman Pallone and the Energy and Commerce Committee includes funding to address social determinants of maternal health, resources specifically for community-based organizations, and investments in programs to grow and diversify the perinatal workforce. There's also funding for maternal mental health equity grant programs, for maternal health research at minority-serving institutions, and for health professional schools that are addressing the impacts of climate change-related maternal and infant health risks. There are investments to promote representative community engagement and maternal mortality review committees, offering bias trainings for healthcare professionals, strengthening federal maternal health programs at the CDC and NIH, and expanding access to digital tools that promote maternal health equity. In the coming weeks, debates about the Build Back Better package will continue, but it's critical that we prioritize these maternal health investments that mothers, babies, and families are counting on. There have been too many alarming statistics, too many devastating stories of loss to wait another second. So I look forward to joining my colleagues with us today and other champions in the House, in the Senate, and in the White House to get this legislation passed and signed into law. Together, we can save moms' lives, end racial and ethnic disparities in maternal health, and ensure that in the United States of America, every family can thrive. Thank you, and I look forward to taking your questions.
Thank you so much, Representative Underwood, and all of our guests for those remarks. We're now going to turn it over to members of the press for questions. To ask a question, please type your name and outlet into the chat box, and I'll call on you in the order we receive inquiries. You do not need to type your question, just your name and outlet. When I call on you, please unmute yourself to speak. Please also make sure that you note who your question is addressed to before you ask it. If there aren't any questions on logistics, let's go ahead and get started with the Q&A. First up, we have Alice Olstein with Politico. Please go ahead and unmute yourself to speak.
Hi, thanks so much for doing the call. I wanted to ask, you said, you're sending the message that it's very important that these provisions don't get cut as the overall package gets trimmed back. Is there concern that it is vulnerable to being cut, that it's sort of more vulnerable than other healthcare pieces, and that's why you're, saying we have to hold the line on this? Thank you.
Well, I just say that, what's really clear is that we are united in that this is a priority. This is a longstanding challenge in our country, maternal health, and explicitly the disparities that we see for Black and Indigenous and other birthing people of color. But we have these evidence-based solutions, right? Expanding postpartum Medicaid coverage, an evidence-based solution. The comprehensive policies that we're advancing in the Momnibus are evidence-based solutions. And we have wide-ranging agreement across our House Democratic caucus, and Senator Booker can chime in here, but among Senate Democrats, that this is a priority that we want to make sure gets funded. I think that we want to raise our voices now to make sure that people understand exactly what's in this Build Back Better Act. This is a provision that hadn't necessarily gotten huge coverage in the press once it passed out of the Energy and Commerce Committee. We want people to know that it's in there so that then when we can get this signed into law, we can all celebrate together because we have the opportunity to save moms' lives, and that is what we're here for.
And I'll just add that not only is it a priority for senators, I've talked to the chairpeople of the various committees, from Chairman Wyden to Chairwoman Patty Murray. I was in the White House yesterday in the Oval Office talking about Black maternal health issues with the President of the United States, and he has it as, I would say, described it best. His reaction was an enthusiastic priority for him and his team as well.
Great. Thank you so much for that question, Alice. Now let's go ahead and hand it over to Dorothy Mills-Gregg of Inside Health Policy.
Yes, hi. Thank you for holding this call. I'm very curious, jumping off kind of the last question, if we're looking at comprehensive health care for new mothers, what elements of the bill are kind of severable from each one? Because there's so many elements. I imagine each one kind of can stand on its own.
Well, again, the Momnibus is 12 bills that have been combined into one comprehensive package that we call the Momnibus. For example, you heard us talk about the Perinatal Workforce Act. We talked about the Moms Matter Act that Congresswoman Blunt Rochester has introduced. We have a variety of standalone bills that were included, meaning funded by the Energy and Commerce titles that they marked up. And so, we want all of it. Okay, we're not trying to separate things. And so let's just stay focused on that mission. There was broad agreement to pass it. This is a priority, and we're committed to seeing it across the finish line.
And I would join in the same thing for the Mamas Act. There were 4 parts to it. And even though we filed it all together, but then we have taken parts just for extra backup. And actually, some of the other parts of the bill, data collection, best practices and things like that, they're bipartisan. Myself and Rep. Latta, he joined me to get these bills passed, and he's also a member of Energy and Commerce. But yes, we do want all of it passed. We need every single piece of it to be successful and to save moms' lives.
And this is Gwen Moore. I would just add, it's a package because Black and Native women come from different strata. I think Robin Kelly mentioned earlier that they've talked to everybody from Serena Williams to women who are in prison who are pregnant. And we've anticipated the complex nature of maternal health for people of color. I mean, we've looked into the reason. We know that there's no quote unquote gene that causes it, that it's really contributory from a lot of disadvantages in science. Everything from, we could really use a doula for an at-risk pregnancy, someone who is very young, maybe, to make sure that they get to the doctor's appointments. And that wouldn't necessarily be the same sort of support that you would need for someone else. And so we've sort of anticipated the plethora of problems, and that's why we are not even thinking about it being separable.
And if Congressman Pallone, let me just say too that, what we've talked about and sort of zeroed in on today is not a lot of money in the overall bill, right? And so there really is no reason to cut back on any of this because it's not a huge amount of money. And of course, I should also mention that we haven't even mentioned other provisions that are relevant too. We're sort of just highlighting it. So Gwen, for example, mentioned people that are incarcerated. One of the provisions in the markup says that when you leave prison, that you can be signed up for Medicaid 30 days before, because we've had problems with people leaving prison who, they can't sign up for Medicaid until after they leave, and so they have a break in coverage. So I only emphasize that we've got to protect this because, anything can happen over the next few weeks, but I don't want you to get the impression that this isn't something that we expect to be cut. I do not, but you always have to be vigilant around here. That's the bottom line. So that's why what's happening today is important to get this word out.
Thank you so much, Dorothy, for that question. I'm going to go ahead and pass it to Rachel Cohen of The Intercept.
Thank you so much. Thank you for being here for this conversation. In this discussion around family planning and maternal health, could some of you please speak a little bit more about what lawmakers are doing in the reconciliation process around expanding access to abortion services and contraception, particularly in states that have aggressive telemedicine restrictions and other restrictions on access to care?
Well, Judy Chu, our colleague Judy Chu, has put forth a bill that's dealing with with what happened in Texas and what might be impending in other states to protect women's right to choose and to have abortions. So I believe that'll be on the floor tomorrow, if my memory serves me correctly.
Thank you, Rachel. Do any other speakers want to address Rachel's question? Hearing no one. Great, thanks, Rachel. Let's go ahead and move to Robert King of Fierce Healthcare. Robert, are you able to unmute yourself?
I should be unmuted now. Can you hear me?
Yes.
Okay, great. I wanted to ask real quick, is there a recognition now that the $3.5 trillion is going to be pared down? And is that kind of the impetus behind this call? And if so, how do you deal with there's another conference that's happening actually with, I believe, Senator Booker in a couple hours on other healthcare priorities. So how do you kind of juggle these other priorities that might want to, stick around?
Well, I'll just jump in what the chairman just said, that what we're asking for is not that much money in the whole scheme of things. So we don't think we're competing against the other factors. At least I don't think we are, I'll speak for myself, but because it's not that much money that we're asking for, in my opinion.
And these are key policies that were included in President Biden's American Families Plan. They are essential to the Build Back Better Act. And we know that we stand united in a commitment to passing this legislation. And so what we are here today is really to celebrate the historic, extraordinary progress with that energy and commerce markup, the fact that we could have postpartum Medicaid expansion and a significant investment in addressing our nation's maternal mortality crisis to move at the same time as part of this Build Back Better Act. That's really what was the impetus for this press conference. And it is extraordinary that we could have this cast of congressional leaders come at one place and one time to talk about this issue, maternal health and the disparities we face in this country. We are not here coming from a place of like weakness or uncertainty about the political landscape for our legislation. We are here to lift up the historic investments that we are about to make to save moms' lives in this country.
This is Gwen Moore again. I guess I just want to add, I was a little stunned at the earlier question about what we're doing with regard to abortion. As a person who is passionate about a woman's right to choose, this press conference really aligns us with another of my passions, and that's to end maternal deaths or to decrease them. It's a disgrace, as we've already discussed. That when we start talking about the cost of stuff, that women dying at 3 to 5 times as any other women in supposedly the most industrialized, richest country in the world is a disgrace. And this ought to align us with the values of everybody who wants to see great outcomes for parenting. Those people who claim that they love children before they're born. And this is what we're trying to do. We're trying to make sure that these people get into the world safely. And our effort to codify the right of a woman to choose is something that we are rabidly intent on doing as well. But that is outside of the discussion of this reconciliation package, because we are rabid about getting this done as well.
Great. Well, thank you so much, everyone. I know many members have a hard stop at 12:45, so we're going to wrap up here with questions. But if you do have any follow-ups or want a recording of today's call, please email press@tcf.org. We'll put that in the chat as well. And with that, I'll pass it to Marcela Howell, who will then close us out.
Thank you very much. My name is Marcela Howell, and I am the president and CEO of In Our Own Voice, National Black Women's Reproductive Justice Agenda, a partnership with 8 Black women's reproductive justice organizations across the country with a goal to amplify the voices of Black women, femmes, girls, and gender expansive people on issues that impact their lives. So on behalf of In Our Own Voice and our other hosts and our colleague organizations who work on maternal health, I would like to thank all of the members of Congress who joined us today. You are fierce champions of improving Black maternal health outcomes, and we are so grateful for your continued leadership. Now is the time to pass these life-saving maternal health investments. Black women, including members of my own family, friends, staff, and colleagues, cannot wait any longer. Every day that goes by without these investments means real people risk dying during what is supposed to be the most joyous moment of their lives. It is high time that this country value and invest in Black and Indigenous women and their families. These maternal health provisions must be included in the final reconciliation package and signed into law. Our lives depend on it. And I want to thank again the members who champion this work. And I'm going to turn this over to Dr. Jamila Taylor.
Thank you so much, Marcela. That's it for our program this afternoon. Again, look forward to the recording afterwards. And if you have any follow-up, reach out to press@tcf.org. Thank you all so much.
Doc,